Think you know all the Lambeau Field Atrium has to offer? Think again. Shop, eat, meet, greet, see, look, leap, love, learn, laugh, share, experience. From Lambeau Field tours to the Green Bay Packers Hall of Fame, from the Packers Pro Shop to 1919 Kitchen and Tap, even holding company meetings to hosting special events. Take it all in. Go all out. Experience the energy and vibe only the Lambeau Field Atrium can offer. Visit Packers.com to learn more.
Ladies, we are here for you. This is episode 10, Cough, Laugh, Sneeze.
You having this issue is not solely because you didn't do your Kegel exercises.
I'm Corey Jensen, your host for this Dare to Ask podcast. I'm a mom to a big family and have delivered 5 babies. And like many women, I try to stay informed about my wellness as well as the health of my kids. We've created a space to have open conversation about what's going on with the woman's body without feeling intimidated in a clinical setting. A place to talk like girlfriends do. A space that dares to ask.
We're here to make a connection, be authentic, and really get to know your provider. Yes, know the person behind the stethoscope. Dare to Ask will be where you hear the questions that we are all curious to know, but just need a space to do it. You've landed on the Dare to Ask podcast, show hosted by Corey Jensen and sponsored by Essentia Health.
Patients coming in just scared because they feel this, and they're like, what is it?
Urogynecology with Dr. Erin Maetzold of Essentia Health. First of her kind in this area that is offering this service, which is really a remarkable thing for women and women's health. So since we titled it Cough, Laugh, Sneeze, which I had to chuckle about just because we all know exactly what that means. Woman over a certain age, or if you are a mom, just saying cough, laugh, sneeze. If you know, you know. We get into some of the biggest barriers with pelvic floor issues. Many women don't even want to talk about it with their own doctors. However, Dr. Maetzold really has this approach with urogynecology that has wisdom behind it and gentleness. She makes you feel comfortable, and she does it with a sense of humor and assures us that we are not alone with these common issues. We're going to cover some hot topics too, like peeing when you cough, laugh, or sneeze. She gives us hot takes on undergarments, when and when not to wear underwear, what kinds of underwear, our pad usage, and even the kind of soap we use on our vaginas, and how it could be a vicious cycle. We get into all that, even how many Kegel exercises are really necessary. So let's get to it.
Yes.
How long have you been in Fargo?
Recently, I just moved here in September, and so only a few months, but I am originally from the Dickinson area, and so I did my undergrad at Concordia College. So I'm very familiar with the Fargo-Moorhead area, and I have a lot of family in the area too. So
great.
It's kind of feeling like coming home.
Yeah,
so,
you're more like coming home.
Definitely used to the North Dakota winters.
Oh, that's good. Okay, I'm going to have some questions to kind of get to know you real fast.
Okay.
Are you in person or online shopper?
Online. I love it. It's
Once you go
so
online,
you can't go back.
It's really hard.
Yeah, exactly. But there are some cute boutiques around town that I have liked going and stopping in.
Yeah.
So
those you have to stop in.
Yeah.
Support and shop local. Your favorite kind of food, where do you like to go to eat?
I've gone to Maxwell's a few times. They've got some really great food. I think my favorite, I really like a good seafood. So places that have good seafood options. I'm a lover of chocolate. So any place with a good chocolate dessert, it's going to pull me in.
Oh my gosh. Yeah. What is your go-to order?
Chocolate lava cake or like a chocolate cheesecake.
Oh,
that's the best of both worlds. Yep.
Feelings on chocolate creme brulee.
I've never had that before.
Yeah.
Well, now I'll have to.
I'll give you some recommendations when we're done here today.
Oh, good.
There is one place. So
okay.
Good. I'd love to know a little bit more about you from a personal level. What is your status in life? Are you married? Do you have a partner? Do you have any kids?
I have a partner, kind of a newer relationship. It's been hard to do dating and residency and fellowship and all of that stuff all at the same time. So I feel like I'm finally kind of able to actually have a social life outside of work. So, but yes, I have a partner, and I have 8-year-old cat that has been with me through a lot, named Rufio. And then this summer I decided to get a puppy. So I have a golden retriever, 6-month-old golden retriever puppy named Lily, who is just the cutest, except for when she's destroying my house.
Right. You are so right on. I mean, the energy... there's nothing that compares to a golden retriever's energy, especially puppy days.
Yep.
But there also nothing compares to golden retriever puppy ears.
Oh,
the softest, the cutest, so cute. Their little puppy breath, everything is so adorable.
Yep. And when I let her out of her kennel in the morning, the cuddles, it's just nothing compares to that. So it's been wonderful.
Well, this is good. So now that I know that you're dating, what is the best way to date? Dating apps, blind dates, what's your favorite?
I feel like everyone these days is meeting by dating apps, and so but it's kind of nice. Like my partner right now, we met on a dating app, but we had a lot of mutual friends, so have relationships to the Fargo area. Okay. So that kind of worked out nice, where you kind of still know people who know each other. So
I mean, let's be real. Like, you need a little background.
Yeah,
come on, give me the scoop.
It's not as intimidating when it's like, oh, you know so and so. So
that is so true. Okay, so is it your preferred dating apps?
No, I mean, I would much prefer being able to go out and meet someone organically, but you can't, like, as an OBGYN where I work with women all day. It's just something that you can't. And then it's like you have a few friends that have single friends, but not many. So
it doesn't feel like the way it used to be. I mean, it's got to be such a challenge, but also kind of fun too. Yeah. Because you can get a lot of those in-person dates out of the way just via conversation. I don't know about you, but that's basically how I communicate with everyone in my life anyway. I'm on Messenger or I'm sending texts, and that's how we communicate.
Exactly. Well, it's just a way to like open an introduction to people, and then it's like the rest of it you have to do as you normally would. Yeah. So
let's get a little personal into your family life. Yeah. Like, take me into little Erin's brain as a girl.
I think I always knew that I wanted to do something in kind of sciences, whether it be like healthcare or, I was thinking, like some sort of like veterinary medicine or something like that. It was always something like the biology classes always really interested me. And when I was living in Dickinson, they actually had opportunities to shadow in the hospital. And so I remember a head doctor who was in charge of that was Dr. Arnold, who was an OBGYN. It kind of came full circle when I was in medical school. I got to rotate with him, and I was not thinking about OBGYN at all. It was just kind of like, this is convenient to go work with Dr. Arnold again. And then I was like, I really like OBGYN. In medical school, you get to see like all of the OBGYNs in North Dakota do kind of a smattering of like all the different subspecialties that we have. And so, I never really had urogynecology on the radar. Right. And sorry, I'm kind of getting ahead of myself, but yeah, of course not. So I didn't initially have urogynecology on my radar, but then when I got into my residency, I was rotating in urogynecology, and I just really loved the patient population and being able to help kind of women with pelvic floor disorders. Yes. So overall, I'm like, this has been incredibly rewarding. You were already in medical school when you started to go, okay, this is where I'm zoning in, I'm vibing. I feel like this is the direction I'm going to be. Exactly. Prior to that, where did you go to college? So I went to Concordia College in Moorhead, and really enjoyed my time there, and got to I majored in biology, and got to work with a lot of wonderful professors there that really sparked my interest in kind of the healthcare field. And then after that, I went to the University of North Dakota for my medical education. Nice. And then I've kind of gotten to experience a lot of different areas of North Dakota. Yeah, you have. And so I got the Fargo-Moorhead area when in college, then went to Grand Forks, and then I actually went to Bismarck for my 3rd and 4th year of medical school, and then did a couple of rotations out in Dickinson to kind of go back to where I grew up. But noted too, because you're in scrubs today. Very copper colors here. Yes, I got my maroon on. Any activity
activities in school?
Growing up, I was in swimming. So I did swim. We didn't have enough people from Dickinson. So I swam for Williston High School. Really enjoyed swimming. Had a lot of frozen hair throughout the winter. I also played clarinet in pep band. So growing up, I really enjoyed those.
Yeah. Since you're a pet person now, were you growing up as well?
Yes. So my dad liked to go hunting. So we had hunting dogs. So we had Springer Spaniels growing up. And yeah, they were so sweet.
Have you ever lived anywhere not North Dakota?
Yeah. So after medical school, I went to my residency in Cincinnati, Ohio. I tell people like I went down south for a while because it was just so much more south than what I was used to. So, and it's kind of south adjacent, being right next to Kentucky. So nice to have some calmer winters for a little while.
But wasn't for you.
I ultimately wanted to come back closer to home. And so so I feel like I got a great education there. I initially wanted to do kind of general OBGYN, but then just rotating with some of the urogynecologists in Cincinnati, they really sparked my interest in urogynecology and being able to take care of a lot of the conditions I treat are kind of after you have your baby. And so it's kind of like things that can happen to the pelvic floor as we age or as a result of childbirth and other issues. So I thought that was very rewarding to be able to, women who think that they have these issues and there's no treatment for, or they don't realize that there's treatment for them. And when they finally are able to get some relief from their symptoms, they're just so relieved and so happy that they were able to find something to help. I like to fix things.
I like to fix things too. So let's get into urogynecology, really a brand new service line that Essentia Health now offers. You're very unique in the entire state of North Dakota. Will you explain what is urogynecology? Why that's special now to our area here?
Yeah, so urogynecology, or it's also called female pelvic medicine and reconstructive surgery, which is kind of a mouthful, which is why we go with urogynecology, subspecialty of OBGYN and also urology. So you can kind of have different pathways to take you to this particular point. Focuses on women who have pelvic floor disorders, which are a result of kind of a weakening of the connective tissues or muscles in the pelvis that can lead to certain different disorders. It's primarily things that are affecting like the bladder, the vagina with prolapse, and also some kind of constipation, fecal incontinence issues as well. Things that affect the pelvic floor as women age as the result of childbirth or other connective tissue issues.
Why is this new to this area, if you will? Because you basically have a department to yourself.
Yeah. So it's the specialty as a whole became approved board certified specialty in 2012. So it's overall kind of a newer field, although there have been fellowships for many years. It's kind of become a recognized and certified specialty as of 2012.
And that's got to be just because of the need.
In the past, many OBGYNs did some urogynecological procedures, but as the specialty kind of advanced and more techniques are being developed, there was a need for kind of specialized training within urogynecology or with kind of specializing in the urogynecological field. And so it just grew and grew and grew until the point where it kind of became its own specialty. I think, being a urogynecologist, I have a unique kind of skill set to be able to offer multiple different treatments for each pelvic floor disorder or condition.
Yeah. Well, give me a scope of those treatments. Some simplest forms to the most advanced.
Yeah. So like even prolapse is one of the most common referrals I get.
Oh, sure.
And so with pelvic organ prolapse, I usually talk with patients that, their treatment is based off of your symptoms and, what fits you in your lifestyle. And so there are a wide range of things that we can do. So prolapse typically isn't something that is life-threatening or, life limiting. And so what we do and where we go is really based off the patient and what they want. There's always the option to not do anything. So in some women, prolapse doesn't necessarily always progress. And so in some women, it may just stay the same. So some patients just come to me really for reassurance that, okay, you do have a little bit of prolapse. And if it gets to be bothersome, here are the things that we can do for that.
Sure.
But then also for patients, sometimes it's just the irritation or they have a very mild prolapse and they're wondering if there's things that they can do to help. And so sometimes doing like a vaginal estrogen or just trying to figure out ways to make things a little bit more comfortable, whether that be with our pelvic floor physical therapists. We can kind of sometimes do very minimal things that really help the comfort for patients. For patients who are bothered by their bulge, but they're like, surgery isn't right for me right now, or, have other medical conditions where they're like, I'm really nervous about surgery with these other medical conditions that I have. We can offer things like a pessary, which is just a silicone device that goes into the vagina, and it can help push the bulge up so that they don't feel it anymore. Okay. And so it's a nice option for many patients.
Sure.
For those patients who do want to have surgery or are good candidates for surgery and are really bothered by their bulge, I do have a wide range of different options that we can do as far as fixing the prolapse. And so just figuring out what is prolapsing and targeting that anatomy and making sure that we are appropriately getting the bulge to go away.
Right.
Yeah.
So is this one where you're doing robotic surgery or more traditional?
Yes. So both. So I do offer patients vaginal surgery because that's very minimally invasive. You don't have any incisions on your abdomen. Yeah. And so many women really like that as an option because all the incisions are internal. And so healing from that it's usually goes very well after those types of surgeries. But for some patients, either with the degree of the prolapse that they have or because of their lifestyle, like they're very active and they do a lot of lifting, then I may recommend doing something called a sacrocolpopexy. And what that means,
that's a mouthful.
It's a big mouthful. And so what that means is kind of putting a mesh or a graft into the abdomen on the front and the back side of the vagina and connecting that to ligaments in the pelvis. And so that just is a little bit more sturdier repair. And so for patients who have kind of more prolapse or are more active, I tend to recommend that surgical approach versus some patients, a vaginal approach is perfect for them. They have kind of milder prolapse symptoms or, they're not quite as active. And so, that type of prolapse approach can be preferred. And also kind of target based off of where their prolapse is coming from.
Yeah. Because there can be a few different areas. You had mentioned organs, but specifically, what usually are you prolapsing?
Yes. So that's a great question. And patients ask me that all the time. It's like, what exactly is dropping? Yes. What am I feeling? Yeah. And really, it's usually what patients are feeling is coming down is the lining of the vagina, which in front of the vagina is the bladder. And so people will often say, my bladder dropped. Well, it's the front wall of the vagina, and usually the bladder is right behind it. And then same thing, like the back wall of the vagina can bulge out and the rectum is right behind that. So as you can imagine, sometimes patients also have bladder and bowel symptoms along with their prolapse. And then also, if they have a uterus in place, they can sometimes feel the cervix, which oftentimes feels a little bit firmer. And so many times I have patients coming in just scared because they feel this and they're like, what is it?
Like, we don't usually feel our cervix.
You don't. And so that can be what people are feeling when they feel prolapse.
Wow. Yeah. I had such a wonderful privilege of being in the delivery room with my best friend. And after delivery, she just suddenly, oh my gosh, what just happened? There's blood everywhere and we heard a noise and she ended up with a prolapse.
Vaginal deliveries are definitely a risk factor for prolapse occurring. What you're describing, I think what probably was the uterus kind of prolapsed, like kind of inverted, which is a little bit different. That's not a specific risk factor. But, anytime someone has like a vaginal birth, it definitely is a risk factor for prolapse developing, as well as other kind of urinary issues like stress incontinence, leakage with cough lapses, which is another thing that I can help women with. But yes, so it's definitely one of the main risk factors is childbirth and then aging, which are things that we can't exactly do anything about. So,
but you want to have a family, there's going to be that. Aging, father time, still undefeated.
Yes, exactly. And so, usually I tell my patients, like, with prolapse, it's not necessarily anything that you did, because a lot of times patients come in and are like, I was on the farm lifting for all my life. Is that why I have this prolapse? And it's like, well, there are people who do repetitive heavy lifting may be at increased risk for prolapse, but we don't necessarily know that there's a necessary cutoff. It's mostly kind of the childbirth, the repetitive heavy lifting. And then also I try to tell patients, it can be related to weight. So, trying to avoid obesity if possible. And then also chronic constipation. So that kind of straining and pushing kind of weakens those tissues around the pelvis as well. So trying to patients who come in just primarily for like kind of reassurance and then like, what can I do to prevent this?
Yeah.
It's just kind of trying to modify those figure out which risk factors can be modified. But oftentimes I tell patients it's nothing that you did. And this is about quality of life and improving your quality of life. So some patients are like, should I not lift at all anymore? And I'm like, if that brings you joy, like going to the gym and lifting weights, no, you should still do that. And then but kind of trying to modulate, like not doing maybe like deadlifts, but kind of but still being active, because I think that's very important for your overall health and heart health and everything.
Oh, it is. Love just the calming presence that you bring to a space, because I've only just met you, and yet I can see why your patients are drawn to that. Like just being reassured to know, okay, here's what's totally normal. Don't go changing your whole lifestyle. But if we were to talk preventative, the pelvic disorders that you are able to treat, do you have a few things that you make sure you tell all of your patients?
It is hard because I think there are not great ways to fully prevent pelvic floor disorders, because they are so related to, childbirth and aging. Things like Kegel exercises. So usually if I have someone who's coming in and they have kind of some mild symptoms, I usually give them a handout on like how to do your Kegel exercises, when to do those. And patients who do like even like pelvic floor physical therapy, where you work with a physical therapist who is specialized in strengthening the pelvic floor muscles. Yes. As long as you continue on with those exercises, it can be very effective at helping to reduce those symptoms. And so usually those are kind of the go-tos I go for preventative and kind of trying to reduce the symptoms as well.
The title of our podcast is Dare to Ask, that I am the one who is able to dare to ask maybe the questions that some patients are afraid to actually pipe up and ask their doctors. Okay, Kegels. How important are they really?
Some patients come into my office and they're blaming themselves because I didn't do my Kegel exercises. Kegel exercises can help to a point, and it's only a component too. So your Kegel exercises are going to strengthen your pelvic floor muscles, but there's a lot that comprises the pelvic floor. So you're going to have different connective tissues, and then also with childbirth, sometimes those muscles can have tears. We're learning more about this now because a lot of researchers are doing work looking at ultrasounds of people after childbirth to see if there's certain tears in the muscles that can be kind of contributing to the development of pelvic floor disorders. So I think we're going to find out way more information, in the future.
Fascinating. The growth of this whole field.
Yes, exactly. So, Kegel exercises alone, I say don't blame yourself because you didn't do Kegel exercises. You having this issue is not solely because you didn't do your Kegel exercises, but they can be helpful. And even like when you start to have symptoms, seeing a pelvic floor physical therapist who can help you target those muscles and doing those exercises regularly should hopefully reduce those symptoms too. Yeah. But yes, something that, if women are like, what can I do, after pregnancy and childbirth to help with my new urinary symptoms? I think Kegel exercises can be great. But also if they're not effective, then talking with a gynecologist or a urogynecologist, because sometimes it's actually the muscles are spasmed. And so it needs a different approach than just strengthening.
So this would be something you'd bring up when? Just if you're starting to see symptoms?
I think it's a good thing to talk about at your postpartum visits. So for pregnant patients, talk with your OBGYNs at your postpartum visit, and then also at your annual wellness exams. And so I've been talking with a lot of primary care providers across the Essentia health system. And so talking with your primary care and just letting them know that you have these issues. They know that either going and seeing a gynecologist initially, and a lot of our gynecologists know how to do kind of, like I mentioned, there's the initial non-surgical options that are great and very simple and easy. Yeah. And so, our gynecologists across the health system are great at kind of addressing those issues. And then if those are not effective, I'm here. So, and happy to help.
That is just so great to know that, there are some answers there. When we're talking about this specific part of the body, and since we were just speaking about Kegels, it can be confusing for someone who thinks they're doing it right, but they might not be. Going to a professional that is able to thoroughly explain and tell you how to do them, that can make a huge difference.
Yeah. I think the biggest barrier to treatment of these these issues is that a lot of times women don't want to mention them. And so there's an element of kind of just embarrassment or kind of thought that this is what happens after, as we age.
Given up. Like, it's just, oops, this is, I knew this was going to happen. I'd have kids. Or I knew, when my mom, after she turned 50, this happened.
Yeah. And like, that's one of the things that really interested me in this area was that as an OBGYN resident, I was talking with a lot of patients who would be like, well, yeah, I do have some leakage, but that's normal. And I'm like, well, I mean, it happens with age normally. Yes, but but there are options that can help to treat it. So it's like, it can happen and it's not something that's, necessarily quote unquote, like wrong, but it's something that there are options to help it.
Yeah.
So
I think too, we're in the Midwest. And there is that implication from just where we are, like, oh, I'm not going to mention that. I don't need to. It's fine. Everything's normal because this just happened. Yeah. And we don't ask the questions that maybe we should.
Yeah.
There could be some options for us.
And especially as women, we are busy with a lot of different things in our lives. And so it's like everyone else's health and wellness comes first. And so then it's a lot of times I talk with people who've been having these issues since the birth of their last child.
Yes.
And then they come to me and they're like, their child is, 18 years old. And they're like, I finally figured I'd bring it up. Being able to help women at that point, I think is very rewarding. But I always tell women, bring it up with your doctors. And I know that there is kind of a push within Essentia to try to find ways to screen for these issues earlier too. So
is your position in urogynecology one that if somebody's listening to this podcast and like, hey, I think I checked some boxes here, can they just call and get on your schedule?
They can call and schedule with me. There is the option for self-referral. I will say that a lot of the gynecologists and the nurse midwives also do a wonderful job with kind of the initial management of pelvic floor disorders. So sometimes people feel a little bit more comfortable initially bringing up those issues with their, OBGYN or their primary care. And so either route I think is great. And so just as long as they are talking about the issues, and they can make a self-referral to me if they would like to talk further about those. So,
I like it. In your field, do you feel like you need to have a good sense of humor?
Yes, to a certain extent. I think I always try to be, I think a lot of times patients use humor to kind of talk about these issues.
Oh my gosh, yes.
And I always try, I think that's, definitely need to be like welcoming and like, yes, it is unfortunate. Can't go on the trampolines anymore. And I tell patients, no matter what I do, I'm not going to get you on a trampoline without leaking. So we can get you running and jogging again, but that trampoline is probably
Some of these fields, you do have to have a sense of humor.
From my perspective, sometimes people, I can tell that they're anxious. And so they are, using humor to try to start talking about things. And so then I try to be like, this is what I see every day is women who have similar issues to you. You're not alone and you're in the right place.
That is so great to hear is that you're not alone and that you have support. You as a woman, what is that nugget of information that you live and swear by?
Trying at least a couple times a week to take time for yourself. Whether for me, it's so hard to get exercise in, but I'm an Orange Theory person. So I'm like, that is something that I'm like, I have to get in my 2 times a week. Yeah. And so taking time for something that you enjoy and it brings you happiness, I think gets you through all of the stressful stuff. So always make sure to take time for yourself.
Whatever that looks like.
Yes.
It's going to be just you time, how important that is.
Yeah.
I asked you the Kegel question, how important they are. What are your feelings about women's undergarments?
First off, if you don't have issues, then, you can kind of do what feels right to you.
Yeah.
In patients who do have kind of vulvar issues where they have irritation or problems with frequent discharge, those types of things, I say cotton underwear is best because it's breathable. No underwear at night so that you kind of let the area breathe and so that, you don't want to have things that are trapping different kind of bacteria or moisture in the area. So cotton and underwear during the daytime and then and no underwear at night. And then trying to avoid pads as much as possible. So I think sometimes that can be challenging for my patients who have leakage with cough, laugh, sneeze, or overactive bladder. They feel like they need to wear pads all the time. And if you're feeling like you're needing to wear a pad all the time, that would be a reason to come and see me. So
Absolutely.
that hopefully we can kind of eliminate the pads, and then that they're wearing pads all the time and that's causing irritation, but then the urinary leakage is causing irritation as well. And so what I do is kind of skin care as well as bladder care. So yes, that's a great question.
What about thongs or G-string?
I think as long as you're not having issues, it's fine.
If you love them, go for it.
Yeah. If you're having some vulvar issues, then talk with your gynecologist about that.
Okay, that's a good one. I have never had a gynecologist. Yeah, you should wear thongs. I mean, I've heard them like, you should avoid them. So I was curious to get your take on that.
You know, I think if there are people who don't have any issues, then, you know, wear what makes you feel comfortable and in your own skin. Yeah.
Yeah.
So
and if your own skin is, I hate panty lines, then go for it.
Yeah. And if you're having issues, then maybe talk with your gynecologist about seeing what else you can do.
And you bringing up the no underwear at night. Now the thing to do really is healthy for you to give this airing, if you will. Some of those great body parts.
I can't find a better like wording or terminology for it. But yes, there's a lot of times patients coming in with discharges or irritations. Things that I usually say to patients is, you know, wash primarily with just water. These different types of soaps that are for feminine reasons, but they can be irritating. And so actually what can happen is people use all these different soaps and they're actually it's a cycle of causing irritation. And so just using water down below, because that skin is just very sensitive. Avoiding any other types of creams other than like, you know, if people have irritation, I'll usually say you can use like a zinc oxide or even like things like coconut oil on that area, just so if they need like a barrier, skin barrier between like their skin and if they're wearing a pad because of leakage, you know, having that zinc oxide skin protectant helps to prevent that irritation on the skin. But yeah, using water down there, use cotton underwear, and then trying to not wear underwear at night, just to, again, let the area kind of decrease the moisture and bacteria and everything there so that hopefully they can be more comfortable.
I feel like this would be a natural segue into talking about vaginal dryness. Where does that enter your field, your scope? Could that be related to some other disorders that I have? Or not?
It is kind of an issue all on its own. And I think that both urogynecologists and gynecologists are able to kind of address those concerns for patients very well, because many times it's postmenopausal patients or women who are breastfeeding or sometimes even being on like a continuous progesterone for birth control. So those are kind of the three groups of people that tend to have more vaginal dryness just because you don't have as much estrogen getting to the tissues. And so most of my patients who are postmenopausal can have some degree of vaginal dryness. And so the go-to treatment is just a topical vaginal estrogen. And so a lot of times patients are concerned because they're like, oh, estrogen, I want to avoid that, because they hear about hormonal replacement therapy, which is an oral estrogen, which does have some risks to it, like blood clot, stroke, and certain cancers. When it's used in the vagina, just in a low dose, it doesn't have those increased risks. So when they do studies of large populations of women, they haven't seen that increased risk. And so overall, I try to reassure my patients that those types of risks are not seen with the vaginal estrogen.
Okay. Yeah. This is good. What excites you about the future in your field?
Oh, that's a great question. I think just raising more awareness. I think there's a lot of people doing work with just kind of social media and trying to raise awareness of these types of issues so that people feel comfortable coming to a urogynecologist and getting the treatments that they kind of avoid getting or avoid talking about, and just kind of making it so that this care is more accessible to women.
And it doesn't have to be you having a baby or have had a baby to start talking about this. I think that's also one of those obstacles. And I've had friends before say, why didn't anybody tell me that my body was going to change in XYZ after having a baby? And sometimes it's like, nobody is trying to keep it a secret. It's just like you said, the normalization of having these conversations reminds us, oh yeah, this might change for you, or this changed for me. Just letting that awareness out there.
Yeah, exactly. And I think I've been trying to raise awareness, like by going and talking to the primary care doctors as well, because I think sometimes it's, not everyone knows what kind of treatments are out there or available in this area. And so it used to be like, oh, well, if you want treatment for that, you have to go to, Minneapolis, or you have to drive far. I think, having that close by is going to be really helpful.
Dr. Erin Maetzold of Essentia Health, Urogynecology. I really appreciate you being on this podcast. And I think that we've got some valuable information here today to get out to people.
Awesome. Well, thank you so much for having me. I really enjoyed helping bring awareness of these issues to women.
It is the humor for me that she just puts you at ease with so many of these pelvic floor issues and disorders. This can be some really serious stuff that affects women's lifestyles and lives as a whole. And just a great perspective, and has got me really fired up for what the future holds. And as technology and things improve, how that could mean real amazing change for our lives as women. More of this good women's health services and talk on the way, as we have a few more episodes left in this season 3 of the Dare to Ask podcast.
The information contained in this podcast is not intended to be a substitute for personalized professional medical advice, diagnosis, or treatment. The information is general in nature. If you have questions or concerns, please contact your provider.